the next condition for which I am going to talk to you about the dietary modifications are constipation. Now, constipation, the word comes from the Latin constipere, meaning to press or crowd together, and from 1400 AD. Constipation is a condition of the digestive system. Constipation means being unable to move your bowels or having bowel movements less often than is normal for you, or having to push harder to move your bowels than you have in the past. That means to say, the normal number of bowels an individual passes is different for each person. Some person once in a day might be normal, for some individual it may be once in 2 days, or for some people once in 3 days. So, when a person who passes a bowel movement once every day is not able to do so even in 2 days, that means it is constipation. So, if there is a decreased frequency for an individual, or one has to push harder to move the bowels, then it is called as constipation. The person suffering with constipation has hard feces that are difficult to expel. In most cases, this occurs because the colon has absorbed too much of the water from the food that is in the colon, and therefore the feces become hard. The slower the food moves through your digestive tract, the more water the colon will absorb from the food. Consequently, the feces becomes dry and hard. Defecation, which is a term used to denote emptying of the bowels, defecation therefore can become very painful, and in some serious cases there may be symptoms of bowel obstruction also. Infrequent or insufficient emptying of the bowel may lead to symptoms such as malaise. Malaise means a person feels lazy, not interested in doing any activity, or not interested in any other work, followed by headache, coated tongue, foul breath and lack of appetite. Now, these symptoms disappear after successful evacuation has taken place. So, these are the side effects of constipation. Now, we have constipation can be divided into two types: atonic constipation and spastic constipation. Atonic constipation is the most common type of constipation. The intestinal walls, they lack muscular tone, so that the peristaltic action is impaired. That means the movement of the stomach is impaired. Therefore, the passage of food is also impaired. The food mass thus cannot move at a normal rate down the GI tract. As a result of this, bacterial action is increased. That is, when the food is staying in the GI tract for a longer period of time, bacteria start acting on the food, on the stagnant food, resulting in various symptoms. Causes are selection of foods which are low in bulk, that means low fiber in the diet, insufficient fluids, that is a person is not drinking enough fluids, poor personal hygiene, that means ignoring going to the toilet or emptying your bowls at the same time regularly due to any kind of preoccupation or laziness, lack of physical exercise, hormonal pregnancy, and in chronic illness, when a person is suffering from severe chronic illness. Now, spastic constipation, this is caused by the increased tonicity of the musculature of the GI tract. That means the contractions throughout the GI tract act in a spasmodic manner, causing the movement of the food mass to be very irregular. These spasmodic movements cause acute pain. That means when the food is passing through the GI tract, it is passing very fast, but at infrequent intervals. So, as a result of this, the food is not smoothly passing through the GI tract, and this results in severe and acute pain. Spastic constipation might be caused by the irritation of the intestinal mucosa by the excessive use of alcohol, spices, tea, coffee, too much of fiber, extreme fiber like bran, or too much use of laxatives. Highly nervous people are more frequently affected by this type of constipation than atonic type. What we mean by nervous people? People who are highly ambitious, who want to meet the deadlines of the work, and such kind of individual you will come across mostly what we call the spastic constipation. Let's have a look at causes of the constipation in detail. Constipation happens when the colon absorbs too much water, as I already told you, or if the muscles in the colon are contracting slowly or poorly, so that the stool moves too slowly and loses more water. Let us look at the common causes. 1. Lack of fiber in the diet. It is well known that people whose diets include a good quantity of fiber are significantly less likely to suffer from constipation. Foods which are low in fiber are high fat foods such as cheese, meat and eggs. So, if a person is consuming too much of these foods, make sure that you are also eating enough amount of fruits, vegetables and whole grains. But if these whole grains, vegetables and fruits are lacking, but you are concentrating on eating more meats, eggs, etc., then definitely this is going to lead to constipation. Now, whole grains and vegetables, as you all should know, are rich in fiber. Diet that contains a good quantity of fiber helps prevent constipation. There are two types of fiber you should know. One is soluble fiber and one is insoluble fiber. Soluble fiber dissolves in water and absorbs a lot of water, while insoluble fiber does not dissolve and neither does it absorb water, and insoluble fiber cannot be digested. However, soluble fiber is transformed as it passes through the digestive tract, where it is fermented by bacteria. Soluble fiber absorbs water and becomes gelatinous as it moves through the stomach or GI tract. Insoluble fiber passes through the gut without changing its form. Quite simply, fiber promotes bowel movements and prevents constipation. Physical inactivity or sedentary lifestyle is one of the other important causes of constipation. This constipation can occur if someone becomes too physically inactive. This is especially the case if the person is elderly. We know that if somebody has to lie down in the bed for a long time due to some chronic illness, perhaps for several days or weeks, his or her risk of constipation is significantly increased. Some say that physical activity helps our metabolism to be high, making most things in our bodies happen more rapidly. Elderly people have lowered metabolism. They also tend to have more sedentary life compared to younger people and are therefore at a higher risk of constipation. Physically active people are much less likely to become constipated than inactive people. I hope this has been quite in detail with regard to the sedentary lifestyle and the importance of fiber. Then let us look at some other causes of constipation. It is common for people to forget that there are a lot of medications. I am talking about drugs being the cause for constipation. Certain drugs can cause constipation. The most common ones are narcotic drugs, opioid drugs, which and also pain drugs such as codeine. In America it is available as Tylenol, then oxycodone and hydromorphone. Antidepressants which people are prescribed for depression, anticonvulsants people are prescribed, iron supplements, calcium channel blocker drugs and aluminum containing antacids are also the reason for constipation in people who consume these drugs and also people who consume diuretics. So, let me sum up all the drugs once again for you students. Drugs such as pain drugs, narcotics, codeine, as well as antidepressants, anticonvulsants, then calcium channel beta blockers for high blood pressure, then aluminum containing antacids and diuretics. Milk. Some people become constipated when they consume milk and dairy products. Now, other disorders of the stomach which can cause alternatively constipation are irritable bowel syndrome, also known as IBS. It can cause constipation more frequently compared to the rest of the population. Pregnancy. Pregnancy brings about certain hormonal changes in a woman which can make her more susceptible to constipation. Also, the uterus may compress the intestine, slowing down the passage of the food. Aging. As we get older, our metabolism slows down, resulting in less intestinal activity. The muscles in the digestive tract do not work as efficiently as they used to do for a younger person. A change in the routine, such as when traveling. When we travel from one time zone to the other or one city to the other, it becomes a kind of psychological issue as well as physical issue. Therefore, this can result in constipation. When we travel, our normal routine changes. This can have an effect on our digestive system, which in turn results in constipation. And also, our food habits change when we travel. Meals are eaten at different times. We may go to bed, get up and do the toilet activities at different times, and all these are a risk for causing constipation. Now, one of the most important things I would like to bring to your notice is the overuse of laxatives. So, when a person has slight constipation, without understanding the cause of constipation and without trying to moderate or modify his diet and increase his physical activity and increase the fluid consumption, the easiest way most people follow is the consumption of laxatives. Now, let us have a look at how laxatives or overuse of laxatives can cause constipation. We all think that we should go to the toilet at least once a day. So, some people are obsessed with this habit. This is a myth. To make sure that happens, many people self-medicate with laxative products they buy at the pharmacy. Laxatives are effective. They do help bowel movements, but the problem is if we continue taking them gradually, we have to reduce the dose. But laxatives can be habit forming. When we become dependent on laxatives, it is a significant risk of constipation once the person stops taking laxatives. So, laxatives in case of mild constipation should be avoided and the person should alter his lifestyle. Another 10th reason or the cause for constipation is not going to the toilet when you feel the urge to go. There can be many reasons for this. Perhaps we are not at home because people are used to their home toilets and would prefer to wait till we get back. And many people never visit toilets at school or at workplace because that is how they think psychologically. Others, there are certain people, as I told you earlier, who are too busy to go, while some people do not go to toilet because of emotional stress. Children often stop going if they are being toilet trained. That is, young children of 1 to 2 years or 3 years of age, when they are being toilet trained, they find the whole program or the plan inflicted by their mother to be very stressful, and this results in constipation. Sometimes children are too busy playing, especially school, and they have the urge, they do not go, or nowadays they have to get up early, get dressed and go to schools. Therefore, they avoid going to the toilet because it takes time. However, if you ignore the urge to have a bowel movement, that urge can gradually go away until you no longer feel the need to go. Therefore, the longer you delay it, the harder and the drier the stool will become. So, one word of caution, young students, that whenever you have the urge to visit the toilet, find a neat, clean toilet and do your bowel movements and don't keep on postponing. It can set in chronic constipation. Next most important is not drinking enough water. Now experts say that if you already have constipation, drinking more liquids relieves it. But if you regularly drink plenty of water, you are less likely to become constipated. So continue to drink plenty of water every day, whether you are constipated or not. If you tend to suffer regularly from constipation, you should seriously consider increasing the consumption of water in your daily diet. Many sodas and drinks which contain caffeine, like colas, they cause dehydration and worsen your constipation. Alcohol also dehydrates the body and should be avoided if a person is constipated or he is susceptible to constipation. Now, if some people have problems with the colon or rectum, tumors of the colon or rectum can compress or restrict the passage of the stools and cause constipation. Also, scar tissue, which is clinically called as adhesions, diverticulosis, and abnormal narrowing of the colon or rectum due to colorectal stricture. People with certain disorders like Hirschsprung disease are susceptible to constipation. This Hirschsprung disease is a birth defect in which some nerve cells are absent in the large intestine, and the intestine does move the stool though, but consequently the intestine becomes blocked, causing the abdomen to enlarge. There are certain other diseases and conditions that tend to slow down the movement of the feces through the colon, rectum or anus are more likely to cause constipation. They include neurological disorders like multiple sclerosis, Parkinson's disease, a paralytic stroke, a spinal cord injury, chronic idiopathic intestinal pseudo obstruction, endocrine and metabolic conditions, uremia, diabetes, hypercalcemia, poor glycemic control, hypothyroidism, etc. Certain systemic diseases, that is diseases that affect a number of organs and tissues or affects the body as a whole, which include lupus, scleroderma and amyloidosis. These are also the reason for constipation, but one should investigate the cause. Therefore, I am giving you all these conditions. In cancer also there is constipation, mainly due to the medications for pain and chemotherapy. Also, if the tumor blocks or squeezes the digestive system, that is cancer of the stomach or GI tract or colon or colorectal cancer. Determination of the cause of the constipation is important to treat it properly. Formula fed infants, that is instead of the mother or the breast milk being fed to the infants, if they are fed through bottles using ready-made formulas, there are more chances of getting constipation than the breastfed infants. If young child, constipation is sometimes due to emotional upset which arises out of the conflict with the mother about toilet training. As I told you, the mother should not push so much of stress on toilet training, but relax the child and let him take his time, instead not standing over there and say go do right now. So such kind of things are also very important, and a young child is the one where the proper toilet habits have to be developed. So the mother should be very careful and not be emotional about the bowel movements and toilet training. Causes of constipation in older children are similar to those in adults. Now in old people, sensitivity of the neuromuscular reflexes in the colon may be impaired, or they may become less aware of the feces in the rectum, which in turn causes constipation. Now I have given you a very comprehensive detailed information about the causes of constipation. Now let us see how changes in the dietary habit of people can reduce constipation in individuals. Now, dietary considerations for constipation include the intake of dietary fiber should be increased by eating whole cereals and increasing the consumption of fruits and vegetables. Whole cereals means whole wheat, millets like bajra, jowar, ragi, not refined cereals like very any product which is made with refined flour and maida like noodles, pasta or pizza or burgers, but using more of whole grain cereals and products which are made out of these whole grain cereals, and increasing consumption of lots of fruits and vegetables. Fruits and vegetables which are also high in fiber, and this kind of fiber, fruits contain both soluble and insoluble fiber, whereas vegetables contain mostly insoluble fiber, and also some of them contain a lot of soluble fiber. The important factor is the water holding capacity of the fiber. The coarse bran, the bran which is the outer skin of the wheat etc., it holds 6 gram of water per 1 gram of fiber, but fine bran holds only 2 to 3 grams water per 1 gram of fiber. Therefore, patients should be encouraged to take coarse bran as a breakfast cereal. Initially, 1 teaspoon of bran may be taken in the first week and increased to 2 to 3 teaspoons thereafter. Fruits and vegetables whose fiber holds water effectively are oranges, apples, carrots and cabbage family. The diet must contain a serving of vegetables, especially in the raw form like vegetable salads at every meal, and 2 fruits minimum every day, that 2 whole fruits, not fruit juices from the above category, especially with seeds and skin. Whole grain cereals and breads should be substituted for refined ones, as I told you already. Fat containing foods such as bacon, butter, cream and oils are useful for some patients for the stimulating effect of the fatty acids on the mucous membrane. Fluids, intake of fluid should be minimum 8 to 10 glasses is useful in keeping the intestinal contents in a semi-solid state for the easier passage along the tract. Some individuals find that 1 to 2 glasses of hot water with plain hot water or with lemon juice are helpful in initializing peristalsis when taken before breakfast. Many laxatives are available, but their continued use may lead to excess loss of sodium, potassium and water in the stools. Therefore, their use is not recommended. Now, another important thing which can prevent or which can also cure and treat constipation is certain correction of faulty habits of the individuals. Now, let us see, students, what are these faulty habits and how to go about correcting them. First, regular toilet training among young children. So, when the child is 1 year old onwards, child should be toilet trained and where to go and how to go. Persistent and unhurried attempts to move the bowels at the same time each day by adults is also important to overcome and prevent constipation. Worry, anxiety, fatigue and change of lifestyle might cause stress, which in turn leads to constipation. Hence, stress should be avoided. Those who suffer from constipation should drink more water and take more outdoor exercises. That is, have a walk in the mornings definitely will cure and prevent constipation. Be more physically active. There are many things that can be done to help with regularity of bowel movements. So, it is very important to stay well hydrated, eat at regular times every day. Skipping off meals or eating less often can decrease the bowel function and cause constipation. So, most important thing is regular meal timings. Be as active as possible. Even if you are taking just a light walk once a day, this activity can help establish regular bowel pattern. eating a good breakfast including a hot drink and high fiber foods at the start of the day. If a person is not having nausea, gas or bloating, try to include high fiber and bulky foods. Now, increase the fiber that one is going to need during constipation gradually over a period of week or 10 days. So, start by adding 5 grams of fiber every day until 2 to 3 days you reach a goal of 25 to 30 grams fiber daily, and this can still be increased. So, increasing your fiber intake quicker than this can cause discomfort such as more gas or bloated feeling. Now, I have already told you, but let me recall: choose whole grain breads, cereals, beans, legumes, etc. for preventing constipation or curing constipation. So, students, I hope this has been a comprehensive coverage about what is constipation, what are the detailed causes of constipation, how the symptoms, when the constipation occurs, symptoms can occur, and simple modifications in our dietary habits and daily physical activity habits can prevent and treat constipation.